But up first, Cornerstone Wellness Center, friend of the show, neuropathy doctor, back to talk with us about neuropathy reversal, Dr. Doug Kane from Cornerstone Wellness Center. Welcome back to the show, sir.
Hey, good to see you again, Garrett.
Glad you're here, and glad you brought a friend with you. Mr. Kevin Lyons is here as a patient of Cornerstone Wellness Center, helping reverse neuropathy. Again, Doc, I do think it's always important to really remind people that if you're maybe just experiencing the early stages or even late stages, you've probably been told there's not much you can do for it.
Yeah, it's either, I'm sorry, there's nothing we can do for you, or let's try some gabapentin. There's some anti-anxiety medicines, because I guess if you can't get any help, let's just kind of make you not worry about it quite so much. Those are just, short-term, mask the symptom kind of things. What we do is we get the heart of the root cause with what's going on, and then once we can reverse that, those nerves can heal, and you can get your quality of life back.
Yeah. Neuropathy, real quick, a quick overview of what that is for people.
In the simplest terms, nerves aren't communicating with the brain properly. And so instead of normal sensation, we get abnormal sensation. So it's usually things like pain, tingling, pins and needles, temperature abnormalities like, my mom felt like she was wading through lava. Other people say, I just feel like my feet are just frozen. A different kind of neuropathy, a large fiber neuropathy, is we get absence of sensation, or what we normally would call numbness. That can lead to balance issues and then pretty serious fall risks.
Yeah, some really serious risks to go with it, on top of just being a very uncomfortable condition to live with. You've brought Kevin Lyons with you. Kevin, welcome again to the show. I'd love for you to give the people watching, or you can just tell me, what were you experiencing? What was your life like?
Yes, so I had the numbness in my feet, tingling, balance sometimes becomes an issue, and those kind of things. And I looked at the internet for nerve flow kind of remedies to where maybe try to get those nerves start talking to me and stuff like that, and limited success with that. I actually went to the Cleveland Clinic and had them evaluate me, and they confirmed that it was neuropathy. And I felt a little bit like, okay, now what do I do? And like, there's no cure, and it's something I'm going to have to live with for the rest of my life. And saw an advertisement with Dr. Kane in the Cornerstone Wellness Center, and thought I'd give it a try. Apprehensive, skeptical, even thought like, is this, like a lot of these advertisements, is this a real thing or not? Is it not using the word scam, but I mean, if, spend money on this and then all of a sudden it doesn't work. So there was a lot of apprehension on my part.
Yeah,
but
so you walked right in here. I imagine you are feeling a lot better than you were in the face of that news.
Yes, it's so through some of his treatments, sonic wave, I think it's called.
Yeah, soft wave.
Soft wave, and some other things I'm taking, and what I do at home. He gave me, instructions for things at home, and it has improved. One exercise is you stand up with your feet about 2 inches apart and put your arms up in the air, close your eyes, and count to 10, and don't lose your balance.
Yeah. And folks, Kevin's almost 7 feet tall. He walked in here. I was looking way up at this man. I imagine feeling unsteady on your feet is a really difficult thing to get used to, and you never really do get used to it.
Well, that's true, and I'm not a young man like years ago, and so walking and being careful, going down the steps. Last thing I want to do is fall down, and I have a rotator cuff issue, those kind of things, and so having these
feeling steady again.
Yes, feeling steady again is a very important thing to me. So some of that is happening. We're not 100%. I think the last time we evaluated, it was like close to 50%. So still work to do, but excited about going through the treatment, and wanted to give testimony to what Dr. Kane's been professing.
Yeah, that's amazing. Dr. Kane, anything you'd like to add to that story?
So Kevin's gained, just in 9 months, he's gained 30% more feeling. there's 140 different causes for neuropathy. Diabetic neuropathy is the most common cause, chemotherapy-related neuropathy. In Kevin's case, it was a lot of trauma. It was a bad automobile accident and some other things that played a role in that. But we always want to get to somebody's why. You know, what's the issue here? How is this really disrupting your life? And a big thing for Kevin is he's a primary caregiver for an adult son that has some health challenges. And so, you know, we got to keep him healthy with all of his faculties so he can be there, you know, for his family as they need.
Doctor, I've been fortunate to meet several of your patients, and I think some of the things that maybe you're not going to brag on yourself as much as you could is the fact that your team can come back to your patients as a full team approach. That's a lot more than, yes, we're going to get you back on your feet. We're going to get your nerve function back, but there's so much more that goes into wellness, right, Kevin?
Right.
And there's, I think, something that I've seen just through the patients that you've brought on is the team that you have in place, yourself obviously leading that team, you make sure that you guys understand that why, and you're setting a team up, you're setting your patients up for true fulfillment again, not just kind of grinning and bearing with some pain and gritting back to their feet. It's really getting back to a fulfilling life.
We've all walked into those offices that has the frosted window and you feel like you're interrupting their day. Our office is not like that. We have over 500 five-star reviews, and almost every one of them mentions our staff, our team, as you put it. We treat everybody like family, and that's one of the things that we enjoy is getting to know the little things about our patients. I mean, I can tell you half of my patients, I can tell you the name of their pets. But yeah, so we really are a tight-knit group. I have a fantastic staff. They're very loving, very caring, and we take a holistic approach. You know, a lot of times people use that holistic in medicine. No, we look at the whole person, and that's what I mean by
we have about
holistic.
We have about 30 seconds left, Doc. If somebody is seeing Kevin's story and saying, you know what, I know I need to do something, what's the process? What should they do right now?
Time is the enemy. This is a progressive degenerative disease. What does that mean? That means how you feel right now today. If you don't do anything, this is the best day you'll have going forward. And so pick up the phone, call my office. My staff is standing by to take your phone calls. You can actually text that number as well if it happens to be busy. Don't wait. 3 months from now, you can have a totally different quality of life.
Kevin, you happy you called Dr. Kane?
Absolutely.
Folks, it is your time to give them a call. Get in there and get your consultation. Visit Cornerstone Wellness Center, mydrkane.com, or the number right there on your screen. Gentlemen, thank you so much for being here. We appreciate your time.
Thanks for having us.
Thank
Folks,
you.
Thanks.